Niagara College's new massage therapy program. The massage therapy program is an advanced diploma program providing students with knowledge, skills, and abilities to provide safe and effective entry to practice care within the massage therapy profession.
Students will learn through a combination of both didactic and clinical experiences over the course of 6 semesters. Didactic meaning your theory courses, and clinical experiences being both on campus in our labs and out in our community. I do want to point out that it is a 3-year advanced diploma that typically runs over 6 semesters. We will be delivering that curriculum over 24 months. So that means 6 semesters consecutively, fall, winter, spring, fall, winter, spring. As you know from some of your career exploration about massage therapy, massage therapists can work in a variety of different locations, anywhere from multidisciplinary health clinics, spas, hotel resorts, long-term care homes, working with older adults, health and fitness facilities, different sporting organizations, hospitals, work for insurance providers. You can operate your own private practice. You can engage in a mobile practice. And we know that the employment of massage therapists is projected to grow between 20 and 25% over the next 10 years. We want to talk about our brand new over 3,600 square feet of our massage therapy lab and slash clinic. It will be one space that is combined to provide students with opportunities to engage in lab experiences with your faculty, and then it will become a fully functional clinic for both staff and students on campus, as well as community members coming into the college. This is a typical practice for us. We have a fully functional dental clinic on campus, and so our community is quite in tune with students providing care and services for their community members. And we look forward to having you on campus this fall. Especially in our lab, the students will definitely be experiencing on-campus activities in the lab and or clinic throughout, in keeping with what we're doing currently with many of our health programs during the pandemic. Again, you may know, because you've been investigating the RMT program, the admission requirements are English, any grade 12 C or U equivalent, math, grade 11 C or U or equivalent, biology, grade 11 or grade 12, and chemistry, it's an or situation here. You have a chemistry course, a physics course, or exercise science, or an intro to kin. And the selection and ranking process is also listed for you online. And we do give equal opportunity up to the February 1st deadline. And then after that, we will be ranked up until February 1st. And then after that, we would be looking at final grades for offers of admission. Registered massage therapy is a regulated health profession. So this is a licensed profession, and the program is designed to prepare you for that licensure. Regulated health professions provide health services in safe, professional, ethical manner. And this includes, among other things, setting and following standards of practice in your profession. Registered massage therapists have a licensing requirement that must be met prior to practice. So students will be prepared through the educational opportunities we provide, but in order for you to practice as a massage therapist, you must successfully complete the certification exams through the College of Massage Therapists of Ontario. There are 2 elements to that exam. The first one is multiple choice and a multiple choice questionnaire testing. And the second one is an OSCE, which is the structured, observed clinical element of the program. So one is written and one is practical. And both elements must be completed successfully prior to you being licensed to work as an RMT. We have built into throughout the entire program, but very specifically in the final term, coursework that will help to prepare you for both elements of that licensing exam. The program itself is delivered in multiple elements. Theory is the didactic portion that is critical, that you have the foundational theory and knowledge to practice. But we, as I mentioned, we have an on-site lab and clinic that students will be engaged in throughout the program itself. And you'll note in the program of instruction that the amount of time you spend in lab and clinic increases incrementally throughout the 6 semesters once you have some of that foundational knowledge underway. It is very much a hands-on learning approach. In the RMT program, much like our other health programs, it's critical that students have an opportunity to engage with patients, clients, other interprofessional care workers. And so we embed the learning into that hands-on practical experience. The clinicals involve also working in the community. Once you have an opportunity to, again, learn some of those foundational skills, we have many partners in the community that support our students in various health programs, and RMT will be no different. We expect that our partners will welcome our RMT students out to engage in community outreach, and as well have the community members come on campus. I just want to share with you very quickly, if I can. Okay, so the link that you see there is the link to the program of instruction. So all of the different courses that you will study over the 6 semesters that you're with us. What I can describe for you, and it's easy to find on the Niagara College website. If you enter the RMT program or massage therapy program, the list of courses will come up for you. But over the 6 semesters, you'll note that each of the semesters have 6 courses. With the exception of the final term, there are 5 courses. And that is because of the amount of clinical that a student would be engaging in versus the number of theory courses. The courses have been very strategically designed to provide foundational knowledge, building on that throughout the course of the 6 semesters. There's all of the theory elements that you require, as well as the clinical elements and the community elements that you require in order to be prepared to write your licensing exams at the end of the 6 semesters. What makes health programs at Niagara College unique? We have amazing educators, both faculty and support staff, who are here to help students both in the labs and in the theory classes. We have there isn't a program in our division that doesn't have experiential learning built into it. And RMT is no different. There is an extensive amount of hands-on learning that occurs both, again, in that lab, which is a supportive, supervised setting, and as well when you go out to the community. Our division is well known for our community partnerships. We have partnerships with all different types of social service agencies, all different types of health agencies, and they continue to welcome our students. I will say also that our community partners help to guide us in our curriculum and through our what we call our program advisory committee. So they're very connected to what we do for each and every one of our programs to ensure that we are dealing with current and relevant curriculum, following our regulatory guidelines, etc. Niagara College has beautiful facilities in terms of simulation labs or virtual labs, up-to-date technology, and something that we use on campus in many of our health programs are what we call standardized patients. So these are actually actors that come in and role play what a patient or client would experience. And the faculty create scenarios that the standardized patients role play, and that gives a student an opportunity to engage with a patient in a protective environment, but it's very predictable because the standardized patient, the actor, role plays exactly what we ask them to role play. And we use that in a number of our programs, and it's very successful. I mentioned our experiential learning, which encompasses real-world experiences. We have various client care clinics on campus. We have a physio and an OT clinic. We have a dental clinic, which I mentioned previously. And we'll have the RMT clinic as well. Lots of community outreach where it is a part of your curriculum, and we will support students in going out to the community to work with those different partners. And we very much use a team-based approach to not only teaching, but providing care. And that includes faculty and support staff, as well as other disciplines, cross disciplines. And that's what we're referring to with the IPE, which is interprofessional education. Interprofessional education is a chance for you to meet other health disciplines, students from other health disciplines, but professionals from other health disciplines, and to somehow work with them throughout your learning and education, not only on campus, but in the community. So each of our health students takes a course called Interprofessional Health Education, where you have a chance to collaborate with other students from other disciplines. You learn about other disciplines, they learn about your discipline, and how you can work together for the betterment of client care. And so that course is taken by each and every one of our health students at some point throughout the course of their learning while they're here with us on campus. Again, as a healthcare practitioner, there are documentation requirements that are critical to every one of our health programs, and RMT is no different. You will be required to have a police check with a vulnerable sector screen. You will also be required to have first aid and CPR. So the CPR, it's either HCP or BLS provider. CPR and first aid are required. And then something called a communicable disease screening process. That is something that the health office here on campus can help you with. You will get all of this information in your welcome package, and it is critical for you to review that information. Without having documentation cleared, you will not be able to participate in lab or community elements of the program, because you're providing physical care to clients, and we need to make sure that you are safe to do so. This is a requirement for all of our health programs, and is something you'll see in red, very important. It's something that takes a while to complete, and so it's critical that you start that as soon as you receive your welcome information package. So hopefully by now, some of you have received an acceptance package, and others are considering whether they will apply, and will also receive an acceptance package. And with that will come a welcome letter. The welcome letter provides the details about documentation that is required. It will tell you a little bit more about what uniforms or shoes are required for the lab portion of the program. And I will say that each and every one of our health programs and some of our justice and fitness programs also have specified Niagara College uniforms, that it helps us to impose the level of professionalism that we expect, not only on campus, but when you're out in the community. It also helps others to recognize which program you're studying in while you're here on campus. You'll see students in varying colors of uniforms, and that does represent their individual discipline. There's also information in your welcome package or welcome letter about the orientation, the program orientation that will happen in September, and other requirements that you need to have in terms of the RMT program. And so please make sure that you review the acceptance package and the welcome letter thoroughly. So this student services are essentially outside of the academic area, but we work very closely with each of these areas to ensure that our students are successful while they're here in the program. Our goal is for you to study hard and be successful in whatever program it is that you've chosen. And we use many of these resources to help support that. Academic advisors, each of the program has an assigned academic advisor, which will help you if you're requiring information about, for example, PLARing a course, or advanced standing in a course, or perhaps you were struggling with a course, what other resources may be available to help you, which leads us into peer tutoring. The college provides fairly extensive peer tutoring if students are interested in having a little bit more help with some of their studies. Perhaps it's one or two courses that you're being challenged by. Peer tutors can easily help with that. Accessibility services is for all of our students to ensure that if they have an accessibility need or a different learning need or learning style, accessibility services can help with that confidential information and then relay what they can to the faculty area so that students are successful. Financial aid is attached to our registrar's office, and they certainly can be of help in giving you information about different bursaries that may be available, or OSAP, and how to help you be successful in achieving whatever financial supports are available for you. Counseling services are housed out of our accessibility services office, and counselors are available to you on and off campus at all times. We do understand some of the stresses that students undergo while they're studying. We want to make sure that we provide additional supports to you, and so counseling can be available to you on campus, and certainly they work with their community partners to make referrals for additional services if needed. SAC is our student council, and we've just recently had a new president elected of your SAC. So it's the council that represents all students. They are exceptionally proud to be at Niagara College and support all of our students. They offer a variety of financial supports. They offer a variety of clubs and social opportunities. And something that students forget that they do for them is advocate very hard for the rights and responsibilities of students. And that might be anything from transportation to advocating for a greater presence on a committee, to ensuring that students understand what they have access to on campus. And our administration has a terrific relationship with SAC. I can't say enough about how they do advocate for our students. Our library resources are available to students both on campus and off campus. They are extensive, and again, a little shout out to our library staff who are tremendously student focused and will help you in whatever way they can to be successful with assignments or to be successful with understanding how you submit a certain essay or project. Making sure that you understand, again, what is acceptable, what's not acceptable. And they have great access to resources to help you to work on some of your curriculum. And lockers, as an RMT student, you will be required to have a locker so that you have a place to put your belongings, your lab kit, your uniforms when you're not wearing them, and lockers are available to students on campus as well. And so we'll open it up to questions, if there are any. Stacy, I don't know. I can't see the chat, so you'll have to let me know if there is anything there. It's a very science-focused program for sure. Physiology, pathophysiology. We have a neuroanatomy course in levels 1, 2, and 3. It's very heavy science in order for students to master the body systems, the body structures, muscles, tendons, etc. And so I would strongly encourage you to continue to take your sciences and to review that information over the course of the summer before you enter the program. Term 1 has definitely an extensive amount of science. Not that we're trying to scare people away, but it's the profession that you're getting yourself into. And once you have an understanding of that, then you move into the more specialized treatments and interventions that will attach that theory to the intervention that you're actually providing. And I do want to reiterate that regardless of the number of theory courses that are on campus in the fall, the lab element of each of our health programs is on campus. We are currently, our division alone has well over 1,000 students studying each week on campus. And we're just following the necessary health and safety protocols. We have proper PPE for students, the personal protective equipment for students and staff. And we feel very safe on campus. If you're entering into a health profession, you know that you're going to be working with patients whether there is a pandemic or not. And so we want to ensure that you have a great learning experience, you're safe while you're on campus, and we will be in our labs for the fall.
Thank you.
Thanks, Stacey.
Thank you.